Hi, my name is Luis Garcia. I am a medical doctor, and I received my education from Boston College in biology back in 1997. Afterwards, I went to Colombia, South America, and received my medical degree from Universidad de La Sabana. And after studying medicine, I became involved with homeopathy, neurotherapy, chelation therapy, ozone therapy, homotoxicology, um, biological medicine, and other alternative holistic practices until I finally learned and started to incorporate biomagnetism or biomagnetic pair therapy. After becoming trained in biomagnetism, I soon realized that it became obvious that the benefits far exceeded all of the other outcomes that I had seen with my previous modalities in my medical practice. I decided to continue studying with the most prominent physicians from South and Central America in learning more about this therapy, and so ultimately and subsequently decided to return to the United States with my family and bring this therapy to North America. Biomagnetism or biomagnetic pair therapy is a revolutionary scientific and therapeutic approach that involves the proper placement of magnets, especially medium to high powered magnets, placed over specific areas of the body to help regulate pH or hydrogen potential. Through the use of magnets, you can move hydrogen protons and atoms around in the body, creating different energy shifts or movements of water, hydrogen, hydroxy ions that ultimately end up balancing your body's internal pH, creating a state of natural equilibrium whereby your organs, muscles, cells can then function adequately to restore balance to your body. It is believed that ultimately pH imbalances in our bodies combine and accumulate to generate different symptoms, syndromes, and health debilitating conditions. Therefore, by preventing these pH imbalances in our body and correcting them, we're able to provide the body the metabolic conditions necessary so that the body can ultimately end up healing itself. Biomagnetism or biomagnetic pair therapy was discovered by Dr. Isaac Gois from University Autónoma de Puebla. He discovered it over 25 years ago, and today it is practiced all over the world, in Europe, in South and Central America, here in North America, and it has been perfected over the last 25 years. And as of the year 2014, midsummer, it will be taught in medical schools in Spain and Mexico as a medical course. Magnets have a north pole and a south pole. Depending on which side or which polarity you use, you can either push away from, repel, or attract another magnet. Although we cannot see the magnetic field that these emit, we can certainly observe the effects of the magnetic field as it's able to push around molecules. If I place one of these magnets over a body part that has an acidic pH, it will cause a muscular contraction in one of the extremities, either the legs or the arms. If, on the contrary, it has an alkaline pH, and I place a magnet in that particular body part, it will cause a muscular relaxation, and we will observe an elongation of that body part. So if you zoom in over here on the feet and take a view from maybe this angle, we can observe how the patient's legs are symmetrical. We can observe an evenness here as well as up here as I'm holding her feet. Upon placing a magnet over a particular body part, we then observe how one leg has elongated, or there is a muscular relaxation, and we observe the right leg longer than the left. It does not matter if I shift her legs like this, we still observe the same length difference. Doesn't matter how much I pull or push, her legs are not going to go back to being even until I balance out with corresponding opposite magnet on the pair that will reestablish balance, thereby leaving her legs equal again. And so once the magnets are in place and the legs are back to neutral or even position, we have to leave these magnets for a specified amount of time in order for the magnetic energy to work and do what it needs to do throughout the body. A typical session lasts approximately 90 minutes, and during each session it is normal to feel different weird sensations traveling on or along the body. As you place magnets at different points, you'll feel either some numbness or maybe cold sensations or tingling sensations, and once again it's due to the movement of the molecules throughout your body. They'll usually last for 2-3 minutes and then disappear. You may also feel tired after the session. It's very similar to going to the gym. If you haven't worked out in over 6 months and you go back to the gym that first day, while you're at the gym you feel great, same as when you're getting this therapy done on yourself. You feel great, but the next day or for the next 2 days you're going to feel tired, same way that you're going to feel after the gym experience. So things to expect after the session are, once again, some tiredness, maybe some healing reactions such as temporary headache or lightheadedness, and these will go away within a few hours. And just like going to the gym creates hundreds of benefits for your body, so does this therapy. However, just like going to the gym, after that first initial visit to the gym, you can't expect to wake up the next day and have much better body or energy. On the contrary, about 1 to 3 weeks after having been to the gym, then you can start to realize all of the benefits in your body. Same exact thing with this therapy. It takes a few days or even weeks for your body to make the adjustments after the magnets have done what they've needed to do, in order for you to start noticing that, yes, I do feel better in certain issues that I had previously. So in summary, I've given an explanation of biomagnetism or biomagnetic pair therapy, which should not be confused with traditional magnetic therapy. Once again, biomagnetism involves the placement of 2 magnets to correct or balance pH issues in the body that will reestablish normal structure and function to our bodies. This therapy is once again practiced internationally around the world, and specifically in Chile and in Ecuador, where it is practiced by medical doctors in the hospital setting for nearly all health conditions. And the number of sessions will depend on each individual case.
So if you were to take my course, by the end of the 5 days, you will learn how to think differently about our health. There are emotional concerns, there are dysfunctional concerns, there are nutritional issues, there are pH imbalance issues. There are a whole variety of things that you have to consider. And so in biomagnetism, the technique involves energy work. It involves the use of magnets placed on the body to literally move, modify, rebalance the body's energy, specifically the pH, which pH stands for hydrogen potential. At the end of those 5 days, you should be able to go home and practice using magnets on your body in order to either stimulate your immune system or reduce inflammation or provoke certain very specific metabolic changes that will allow your body to kind of get a jump start on your health in different ways, in different organs, in different areas wherever you apply the magnets. I invite you to experience the course with me, and afterwards tell me in your own words what biomagnetism means to you.
And I want to give you a little more background and information as to what we're talking about and why this is something that everyone should be getting a hold of, and everyone should be starting to learn to how to heal through biomagnetism, which everybody can do. Dr. Garcia is one of the best, if not the best in the world at this, and it can heal so many maladies, so many symptoms, so many issues, and can be done in so many different ways. So just the magnetic pair is a revolutionary scientific and therapeutic approach to wellness that differs from traditional medicine, homeopathy, herbs, and natural therapies. It's holistic. It covers everything. It's not just a one remedy solution type thing. It goes through your entire system, all the pathogens, your mind, body, and spirit, and clears out the energies to bring you back to homeostasis. It is perfectly compatible with other traditional alternative modalities. It is an internationally practiced health approach that strives to attain bioenergetic balance in the human body using subtle energy healing in the ether. The state of natural health is known as homeostasis. It involves the precise and proper placements of the north and south polarities of magnets on a special high field strength magnets over very specific areas of the body to support regulation of pH in these areas. By maintaining an adequate pH, homeostasis may be reestablished so that the body can heal itself. This therapy stimulates normal immune system functions, increased circulations, oxygenation, normalizing response to inflammation, and many more positive effects in our body. It is believed that pH imbalances may ultimately accumulate and combine to allow the development of syndromes and other ill health conditions in our bodies. So basically, homeostasis is bringing us back from a super acidic state to an alkaline acidic balanced state. All right, and I want to show you an example of this, and here on Dr. Garcia's site at usbiomag.com, he has this is his website at usbiomag.com. You can see it right here. Let me move this up a little bit. There you go. And this is Dr. Garcia, a great man. And we're not going to be doing any training seminars, obviously, for a little while, given all that's going on. But this guy has furthered and pioneered the practice. And here you see, this is me on the table when I went to level 1. And what I'm going to share with you now is I've had issues for years now with my legs. When I started doing a lot of the truth and plain truth and whatnot, and started speaking out, things started happening to my body. My physical legs, which I used to be a competitive skier and a Division I tennis player, basically stopped functioning. I got a drop foot and whatnot. And I went there to learn biomagnetism from somebody that used magnets with me out here in California. And after a few sessions, I started to feel a lot better. I got my balance back. I said, whoa, what is this? So I went to New Jersey, and this is my level 1 training under Dr. Garcia, and he was using me as an example of how he does his scanning. So what I want to present to you is Dr. Garcia doing his actual, I don't call it a practice, I call it a healing sessions with a sole, where he's using the sole of the feet, and he's using one leg to determine bioenergetically to scan the body like kinesiology, called muscle testing, in order to determine the body's needs. He's asking the body what it needs to be healed. And then he puts magnet placements on those areas by going through the body system, and you'll see him do his scan. This guy is the best in the world at this. You should pay specific attention for all you biomagnetic healers that are starting to learn this, because this is something you can learn, and this was me who he was working with. So please enjoy, take notes. If you can join us next Sunday, shoot me an email, and I'll enroll you in the webinar. But this is the world's greatest healing protocol, and I want to share it with all of you because I think everyone can learn to do this, even if you're staying at home. So take a look and leave in the notes what you think of it, okay? And hopefully we'll see you on Sunday.
Okay, so his legs are a little splayed out, so I want to try to bring his hips in, and this is so much better than the other day. Right, Jamie?
Feels better.
Yeah. So here...
It feels like my right thigh is not rotated nearly as far out.
Correct. So here I see the evenness in his legs. Maybe you want to start from behind me so that you can see what I'm looking at. And so we're going to see about his dropped foot. So actually, let me grab... So here we're going all out level 3 stuff.
So have you treated a drop foot before?
Yes. And depending on the cause, it improves. Once again, all of this occurred 5 years ago?
Yeah, and just in a progression, worse progression. I got to the point where I'd be walking in the store and I'd just fall on my face, like 20, 30 times.
Okay.
Pretty embarrassing.
So here I typed in dropped foot, and let's check out Mayo Clinic symptoms and causes of dropped foot. So causes. Nerve injury, boom, yes. We're going to focus on the nerves. Muscle disorder, nerve disorder, brain and spinal cord disorder, nerve injury. Common cause is compression of a nerve in your leg that controls the muscles involved. Pinched nerve. So let's do another Google search for dropped foot nerves. And we're going to go to images.
S1, I'm thinking.
Common foot drop causes. And so, look at that. We've got... okay, it's not showing the nerves. Let's...
L5 to S1?
Yeah.
S1 to S2.
But hold on, let's see. Foot drop. Sciatic, common peroneal. Let's see. So we did sciatic the other day. Sciatic, yes, there's definitely something in his sciatic. And common peroneal, also. So, right sciatic, yes. What color should the right sciatic be? Black? Yes. So, let's throw black.
So you're not trying to get 2 points on his feet to connect because of the dropped foot condition. They probably won't as well at first. Is that right? When you're doing the muscle testing, you mean how you try to have the 2 points when you come together for yes or no?
Oh, so because I don't need to,
Correct.
do this, I can feel his leg shift.
Okay.
So I'm not gonna,
Right.
The 2 points is for you guys to learn.
Okay.
What's a real yes? Mm-hmm. For me, I can feel the
answer. Gotcha. Okay.
So here's right sciatic, and is it to left sciatic? Yes. So even though I placed this on the other day, lo and behold, there was another poliovirus pair hiding out.
In the same location.
In the same location. So poliovirus always goes back and hides out in that. Let's try, is there another? I'm just going to place some magnets and see, is there something else there? No. So, just needed to repeat poliovirus on him. And so, was that for the actual poliovirus again? No. Does he have poliovirus anymore? No. Was that to balance the pH of the sciatic nerve? Yes. So, all right, good. We did get rid of the poliovirus, but he still had another pH imbalance left over in that area. Next, common peroneal nerve. Boom. So, common peroneal. Let's see. I don't know if it's this one or that one. Let's go to another image. For the common peroneal. This one shows it. That seems to be tibial.
For New Jersey,
It should give.
July.
So because I'm not finding common perineal nerve here, I'm going to look for it specifically. Common perineal nerve. Images. There we go. Common perineal nerve goes down this way, so it starts at the popliteal. So at the popliteal, yes. Does it go black? Yes. Left here a little bit. Okay, go ahead down. And there we observe a shift. Where should the other red magnet go? Somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder. As I mentioned, it kept going down, 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 down. So, bladder, black, common perineal, red bladder. There we go. Is there something else in the common perineal? No. So this is going to help take information off of that nerve, which generates down. So that leads to the lateral surocutaneous nerve? No. What about the perineal communicating branch? No. What about the sural nerve? Yes. So the sural connects these two from above.
To the plantar?
Controls that. So sural nerve. What color magnet should go on the sural nerve? Black? No. Red. On the sural nerve. So sural nerve has, if we divide this into top third, medial third, lower third, on the top third, yes. Medial third, no. Lower third, no. Top third. So, top third, over here, red, boom, there it is. So where does the black magnet go? Somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder. Another one on the bladder, but this time it's black on the bladder, red on the sural nerve. And so, back to even. Anything else on the sural nerve? Anything on the medial surocutaneous nerve? Anything on the tibial nerve? Yes, on the tibial nerve. So we're going to, all of this is the tibial nerve, top third, medial third, bottom third. Tibial nerve. Top third, middle third, lower third. I believe I asked red or black. Black, no. Red, yes. Lower third on the tibial. Let's try here. He also has edema. So, yes, we're getting a yes, but it's not the big yeses I'm used to. So, should that be moved higher up, lower down? Gives me a bigger. So, I need to bring it down.
Do you get sensations like almost like there is a voice telling you where it needs to go, guiding you? Because I keep having a guidance to the plantar, and I don't, obviously you muscle test to check that out, but I'm wondering if you have those voices almost that kind of guide you.
Absolutely.
Right?
It's not, in my case, it's not a voice.
For lack of communications.
Yeah.
Get you in.
It's literally a download.
Right? That's
all of
what
a
I
sudden
mean.
An image appears
Pops
in
in
my
your
mind,
head.
or I'm drawn to something else. But
I do absolutely listen to those, but I also like to just go in a certain order
Sure.
so that I don't lose myself and start
Right.
doing things. So there, now we get the big yes. Why? Because when it was higher up, it was a smaller yes, but now it's a bigger yes that I'm used to. So black magnet goes somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder.
Another blood.
Another bladder. There. Nice and even. Once again, anything else on his common peroneal nerve? Yes, no. Lateral sural nerve? Yes, no. Perineal communicating branch? Yes, no. Medial cervicutaneous nerve? No. Anything else in the tibial nerve? Yes. Upper third, medial third, inferior third. Black magnet, red magnet. So I use another red magnet. On the tibial nerve, black goes somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder, urethra, right testicle, left testicle. Left testicle with 2 on the sural nerve. Anything else on the sural nerve? Yes. 3 on the sural nerve. See how now the yes is lower? It's not that much. Before with the first one it was this big. With the second one it was this big. Now with the third one it's that big. So most likely that's going to be the third personal pair on his sural nerve. So on my list you're not going to see sural nerve. It often doesn't appear, but when the patient's body asks for it, I go deeper down that rabbit hole, and that's why I'm using Google to explore all of this. So red on the sural nerve and black somewhere in the head, neck, thorax, abdomen. Abdomen. I have 3 pages worth of abdominal points. Abdomen page 1, page 2, page 3. Transverse colon, descending colon, ascending colon, hepatic flexure, splenic flexure. Boom. Splenic flexure with sural nerve. No idea what that is. And the other option is appendix or ureters or other area there. No. Splenic flexure. Splenic flexure. Belly button is here. Splenic flexure. And boom, even. We're going to go with 4 just to double check. 4 on the sural nerve and even. Nothing else there. 4 is a lot. Going to go down. Anything in the lateral plantar nerve? Yes.
Yes, I thought so.
Yeah. Anything in the medial plantar nerve? No. Medial calcaneus branches? No. Lateral dorsal cutaneous nerve? No. Lateral calcaneal branches? No. Lateral plantar nerve? Yes. Lateral plantar nerve. That's on the inside back calcaneus area. So inside back calcaneus area, probably around here. So I'm focusing the energy right here where my fingers are, and yes, that's exactly where. So should it be black? Nope, doesn't bring it back into balance, and I'm giving a gentle tug, not a. It's just a gentle. Lateral plantar nerve black, no, red. Boom. It just slides in. As long as I'm thinking red, it just slides. So, yeah. Fix. That's on his lateral plantar nerve. And there we see black goes somewhere in the head, neck, thorax, abdomen, and pelvis. Uterus, ovary, fallopian tube, bladder.
I feel it. I felt like the download or the voice for plantar, and then for bladder, and everything you've said is what I've been feeling, and this is incredible.
Isn't it though?
I am tapped in with you, or with Jamie.
Yeah. All right, so nice and even. Is there anything else in the lateral plantar nerve? Yes. So let's throw another one. Red? Yes. But the yes is at the midway point. So that means it might be that's it or something else.
Getting closer.
Getting closer. Black magnet goes somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder, urethra, otherwise known as penis. There, and perfect. Let's see if there's something else in the lateral plantar nerve, and yes, there is. There's just a hair left. See that? Not quite even. Pull hard on it. It just goes back into there. So, where does the black magnet go? Somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder, urethra, testicle, right testicle, left testicle. Another one on the left testicle. There. Okay. Back to even. Let's see if there's a fourth pair on the stroma nerve. Yeah. Anything else on the stroma nerve? Yes? No. So just 3 pairs. Once again, I'm going to go back through and scan. Anything else in the common perineal nerve? Lateral cervicutaneous nerve, medial cervicutaneous nerve, perineal communicating branch, sural nerve, tibial nerve, lateral plantar nerve, medial plantar nerve, medial calcaneal branches, lateral calcaneal branches, lateral dorsocutaneous nerve. Are there any other hairs on any of his muscles? Yes. Any of the bones, ligaments, joints, spaces, arteries, veins, muscles, just muscles. What about the bottom of his foot? At the heel, at the arch. Here are the arches, and so here's one arch, and boom, we see that. The other arch, boom, even. Let's see if there's still something else in the arch. No. So arch of the foot is Ebola. Let's see if there's something else in the left arch. No. So the other pair for Ebola is anterior coastal, and he also has Ebola.
So the Ebola pairs are arch, and anterior coastal.
So below his pectoralis muscle on the rib cage, roughly here where it's the liver. And so you can scan there, but I know where. So. Anterior coastal no longer responds because the magnets are there. So, are we good? Are they in the right placement? That's a big yes. So he's got Ebola.
We had
Does he
TB.
have something on the soles of the feet? Soles of the feet. Toes of the feet? No. What about something on the inside part of his foot? Yes. So this third, this third, yes. So in this general area or this general area? First general space. Second general space, no. First. So here, should a magnet go black? No. Red. Do you have the tape?
Tape?
Okay. Behind
Where did it go?
Right here.
Ah, there we go. Red right there. I don't know what that represents, but his body wants and needs it. Black, no. Red, yes. Yes, because it rebalances. So where does the black magnet go? Somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder. And boom, even. Let's see. He needs another pair? No. Even. Does he need another magnet here somewhere in this area? No. What about in this area? No. What about this posterior area? No. Once again, right now I'm letting you guys listen to my thoughts.
Yep.
But I do this silently and just
Right.
Thank you.
It's probably 3 times as slow saying it
three
out loud.
times as slow. Yes. I'm going to do, is there something in this area, this area, this area, divided by thirds. On the outside, first third, outside, second third, outside, posterior third, no. The one thing that responded were muscles in the legs, and so we have to go back to that. Let's go again. Here.
It's so handy to have an iPad right here.
Hugely.
So you have your app up, but you also go right to Google just to pull up anatomy images.
Yes.
That's
And so
very
we've got all these different, so this is the inside, and on the outside there's the gastrocnemius and the soleus. So
Flexor longus.
will one of these help us? Boom, yes. And just for the heck of it, gastrocnemius muscle? No. Soleus muscle? No. Popliteal muscle? Tibialis posterior? No. Flexor digitorum longus? Boom. Yes. Flexor hallis longus? No. Flexor digitorum longus? Yes. Should the magnet be black? Yes. Flexor digitorum longus black on the right leg. To divide this into top third, medial, and bottom third. Top third, immediately. Middle third, inferior third now. Top third. So that's on the inside part. Flexor digitorum longus. It's going to be somewhere around here. Top third. Boom. There it is. So, red magnet goes somewhere in the head, neck, thorax, abdomen, pelvis, arms, legs. Does it go anterior, posterior, above the knee, below the knee? Does it go opposite side? Yes. Now his body wants us to reestablish pH balance on the opposite side.
same point, opposite sides.
Uh-huh.
It's the flexor digitorum.
Yes. So once again, these muscles, I don't think I've ever placed them on anyone, but once again, bioenergy work has led me there. Right. So here we go. Nice and even. Beautiful.
Is this your first drop foot patient
No.
or
I've
client?
had others.
Excuse me.
Had about 3 others, and all for different reasons. All right. Even. Nothing else there. So I've done the nerves, I've done the muscles. Let me ask again, is there an additional muscle group? Nerves, arteries, veins, ligaments, spaces? Anything else I'm missing for his dropped foot? Pathogen. Emotion. There's another emotion. Is there something else? No. Is the emotion in my list of emotions? Yes. Emotion in column A, yes. Just for the heck of it, column B, C, D, E, A. Odd row. 2, 4. A4. Anxiety. First one. Apathy, asphyxia, avarice, anxiety. Does that resonate with you, James?
In what way?
What's that?
In what way?
Let's see. With family. Let's see. With ex-wife? No. Family. You've been feeling anxiety over your family?
Well, it's been ongoing for years.
Yeah. So say, recent thing? No. Chronic, long time? Yes. Big yes. And so, what is it that causes you the anxiety specifically? How they treat you?
Detachment and how they treat me.
Okay. So, once again, what happened in my case is my father didn't want to have anything to do with biomagnetism with me, and neither did my mother, my brother, my sister-in-law. Everyone thought, I was being silly and wasting my time. I finally realized that I was going to continue moving in the direction that I was going, and I couldn't, hold my breath or wait till one day they hopefully saw things the way I did. I had to continue moving in the direction that I wanted to move in, and fortunately, over time, each one started to fall in line behind me. Granted, that may not be your case, but
No, that doesn't happen. It's acceptance.
yeah, I had to just continue pushing forward and soldiering on, and kind of separated myself from all of their criticisms and when they would come over and just all of a sudden appear at home, and I'd be with the magnets on myself, and they would just give me these looks of you're familiar with those looks.
Well, no, I walked away from Wall Street making millions to go move on a ranch and live 3 miles out of dirt road because I wanted my son to have a life where he could have a chance against the economy and everything, and they didn't understand any of that. They wanted to still, he's Wall Street, they just don't understand it.
And they may never.
And that's okay.
Exactly.
I don't know that.
Correct.
But I know that's the way they look at me, like, you're different now. You're not. My sisters want my acceptance because my dad left my mom, and so I was the oldest boy, and so when I didn't give them the acceptance, they resented it.
Yeah. You still have anxiety over, obviously, family relationships, and I know it's not easy, but it's still there. It's kind of gnawing away at your energies. Do you meditate?
Yes.
Okay. So here I command his body to release that anxiety with regards to his family's treatment with him, of him, now and all future instances. And just really release, don't own it.
I just felt my right leg just super light.
Excellent. Is there another emotion related to his dropped foot?
Wow.
Is there another point that we have to place here on muscle, ligament, joint, space, nerve, artery, vein? No. Is that it? Yes. How much time do we have to wait? 15, 14, 13, 12. 12 minutes. All right. Yes. That one. And it's just as I lift it up, her leg went. Yes. So tonight, place those pairs on yourself.
Okay.
And also either meditate or write down those emotions and kind of visualize releasing them and let go. Continue moving forward. And life is about balance. It has ups and downs. We all experience high points in our life, and we will all absolutely experience low points, whether it's relatives dying or, issues with our family, issues with finances, issues with our job, you name it. I mean, we're never going to stop worrying or stressing and this and that. And at some point, you just have to say, no, screw it. Let me just live life. And so what if this happens, that happens? You keep moving forward in the direction that you want. So, all right. Will you start to feel some very interesting changes? Yes, this is a huge yes. So you place all those pairs, and over the next week or two, you're going to feel so much lighter, and just alive, and energized. Yeah. So.
Thank you.
You're welcome. All right.
Yay.
Ta-da!
I can't wait to see the video.
Oh, yeah. I can't.
10,000.
Deeper and deeper we go into the depths of the seas of the unknown.
By the way, you guys know each other?
Huh? We all came together.
Well, yeah.
The three of
We
you?
arrived.
5 of us.
Oh, 5.
We all know that they're his wife.
Okay.
The nerd is still jury out because she hasn't investigated. The nerd.
So, remind me of what your diagnosis was.
T-cell lymphoma, the same kind as the gentleman who won the lawsuit against Monsanto. It's called mycosis fungoides. It's the T-cells that reside in the skin of lymphoma. They're CD, they're expressing the cell.
Too much info? What? Did you say T-cell lymphoma?
Scoot over just a little bit. Thanks, perfect.
Transform into a malignant T-cell lymphoma.
Okay. So, even though I haven't researched that, I don't have to investigate. With that in mind, whatever allopathic diagnosis they gave you, now I'm going to see energetically what's your body going to tell me in terms of what you need. So, in your case, I'm going to start with spleen. Or we'll do worst common pathogens and then move to the spleen. Somebody's writing down, or you're?
Do you want to write down? What's that? Sorry, I can do it.
Thank you.
Whoever, but so that she gets this. Yersinia? Yes.
Have you placed your Yersinia at all on yourself?
They just did a Yersinia placement.
I just went 3/4 of the way down the rabbit hole on that, and then it was time.
So you didn't put all the Yersinia ones
Not
on?
all, no.
Okay, that's what happens. That's all right.
So when you do it, will you write down, how do you know to follow after you do it, to write, do you write each down as you go?
Check.
Okay. So we should copy that use that for each patient, that sheet.
No, not copy this, but on your scan sheet,
Okay,
make sure all the Yersinia pairs are there.
gotcha.
And then you check off, because it's an Excel spreadsheet, you can do 3 or more pairs there. And so session 1, you do a check, whatever you find. Session 2, check. Session 3, and that way you observe a pattern.
Gotcha.
Several sessions.
Yeah, I was
All right.
watching my
So, Yersinia, yes. Vagina, no. Lung, no. Thyroid, thymus. Did you place that one?
We placed lung.
No, they did not.
Spleen, no. Duodenum spleen. Did you place duodenum spleen? That's duodenum spleen and thyroid thymus are missing. Transverse colon vagina, no. Lung vagina, missing. Did you place that one? Left lung to vagina.
So,
Okay. Either way, it's missing that one. Bladder to vagina, no. Are there any other additional Yersinia pestis points? No. Rabies virus? No. Tuberculosis? No. Vaccine-induced issues? No. Epstein-Barr virus? No. Lyme co-infections? Yes. Anaplasma, Bartonella, Ehrlichia, Mycoplasma. Mycoplasma is temperoxyphilode to temperoxyphilode? Yes. It's also, I believe, pectoralis? No. Is there another additional mycoplasma pair? Yes. Is it a personal pair? Yes. Mycoplasma. Where does the black go? Somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder. Black on bladder with red somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder, urethra, vagina, inguinal nerve. Right, left inguinal nerve. So bladder with left inguinal nerve represents another mycoplasma hideout. So even though I mentioned that bovine leukemia virus hides out in bladder inguinal nerve, left inguinal nerve, well, it also serves as a reservoir. So in this case, mycoplasma. Any additional mycoplasma pairs? No. Thyleria, Epstein-Barr, malaria, babesia, Borrelia, tuberemia, rickettsia, Garcia, TB, CMV, rabies. Any other additional Lyme co-infections? Hepatitis, mosquito-induced, dairy, yes, dairy points.
Look at her face. Guilty.
Guilty as
Charged.
She likes a little coffee with her cream.
oh boy.
Yeah.
So,
And a specific soup.
any cancer, any growth, any tumoral phenomena, eliminate all dairy. In your case, eliminate it for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 weeks. At least 3 months, no dairy whatsoever. Pseudomonas, malaria, pathogenic virus, bacteria, HIV, pathogenic fungus, pathogenic parasites. Okay. So there are dairy points. Is it staphylococcus? Is it diphtheria? Is it candida? Is it listeria? E. coli.
Boom.
Thymus, liver. You can write that down. Index, no. Belly button, liver also. So thymus, liver, belly button, liver. Is there another additional E. coli pair? No. So anything on the thymus is going to weaken the immune system. To Do I need anything else from here? No. Is there anything else with regards to the liver? Either black or red? No. Anything else with regards to the spleen? Yes. Spleen goes black, red. Black goes somewhere in the head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder. Bladder to spleen. That represents a bacteria, virus, fungus, parasites, emotion. Bladder, spleen represents emotion. Is the emotion on this list? Yes. Is it in column A, B, C, D? Is it in odd rows, even rows? 2, 4, 6. D6. Is there an emotion, unresolved emotion that deals with responsibility, resentment, repugnance, reprimand, repression? Is there something that Ingrid is repressing? Yes. Does it have to do with work? Does it have to do with home? Yes. Does it have to do with her immediate family, meaning husband or children? No. Her other nuclear family, brother, sister, parents, mother, father. Something with regards to her father, yes. And can you resonate with a repression with regards to something related to your father?
My father was diagnosed with cancer and died 6 weeks later when I was 22, and I was very close to him. And my mom was in New York. He was gone half the time every year because of his work. And my mom was an abusive alcoholic, and he, on his deathbed, made me promise to work on that relationship with her, and I made do on that promise until last year when my stepmom told me she continued to be abusive with alcohol, emotional, talking bad about me to other family members, ostracizing me, and I finally let go of her last year. And my life has been so much better, but I still feel sad for that. But I know it's the right thing for me because I can't have that in my life. And I've felt so much lighter since then, but it's still, sad. But it's much better.
So, were you repressing something with regards to your father's death or your relationship with your mother thereafter? Relationship with your mother thereafter. Does it have to do with anything else?
Is it within a mile?
No. Bladder spleen. Do we still need to place bladder spleen? Yes. Did that emotion have to do with that exact time period that you described? Yes. So oftentimes when the patient describes something and you obviously want to muscle test and confirm that that's it, because there can be 4 or 5 different emotional events. And if it's not that one, all right, keep going. Like, just keep vomiting them out, bring them out. So confirm that that was one. So is there something else in her spleen? No. Black, red. For stimulating her immune system and getting rid of the allopathic diagnosis that she has, is there an underlying bacteria that we have to address? No. Underlying virus? Yes. Is it a known virus? No, it's an unknown virus. It's a big yes. Unknown virus. Where does this virus hide out? Somewhere in the head, neck, thorax, abdomen. I have 3 pages worth of abdomen, so is it abdomen page 1, page 2. Pylori sphincter, liver, gallbladder duct, ligament of the liver, duodenum, belly button, ascending colon. Ascending colon, I'm going to hold my train of thought there, my intention on her ascending colon. End is an ascending colon with head, neck, thorax, abdomen, pelvis, uterus, ovary, fallopian tube, bladder. Ascending colon, bladder. Does that represent a bacteria? No. Virus. Yes. Once again, it's an unknown virus. I'm just confirming that, yes, it's a virus. Is there another pair for this unknown virus? No. Does this pair also represent an emotion? No. Is there an additional pathogen responsible for her diagnosis? Apparently not. Is there another fungus, parasite, bacteria? Is there another emotion? Yes. Is the emotion on this list? Yes. Is it in column A, column B, odd row, even row, 2, 4, 6, D6, fear, fatigue, fantasy, fanaticism, failure. Failure. Is it with regards to some failure in Ingrid? No. Failure in somebody else? No. Is it a fear of failure? Yes. Big fear. Can you resonate with this?
Completely. When you said fear, I thought fear of failure. In your head, it got to failure.
Is there a specific time period with regards to this? No. And so, can we release this? Yes. I command Ingrid's body to release that fear of failure. It's released. Yes. Simply send an intention and that's it. Is there something else that we must know about this fear of failure? No. But out of curiosity, you can relate to that because out of the fear of failure, you've tried to excel in absolutely everything you've done. Yes. You just go.
Yes,
Overachiever.
I strive for the top.
Yes.
If I don't get there, at least I tried.
Do you know the two of success? There's two reasons people are successful, one of two reasons only, and everybody has an answer. One is fear of failure. You know what the other one is?
Yeah.
Something to prove. It's always one or the other. You can ask everybody, and they'll always have an answer for you.
I have both.
And they can have both, yeah.
My worth after what happened.
With regards to her once again diagnosis, is there, we're going to ask again, a pathogen associated with? Is there another emotion associated with? Is there something else I need to know? Is that it for today's layer? Yes. Did you feel that big like?
Would love to at some point explain and continue to teach everyone all of those points. It's absolutely essential. But with these, you can heal 80% of the issues that come to you. I'm just striving for 100%, and like every little bit counts. And so I don't know what she has going on in the splenic flexure and those other points that we found, but ever since say 2 years ago that I discovered that splenic flexure and hepatic flexure and cervix and all those things, it has been absolutely beneficial for a ton of patients that, you know, I love to keep going with all of this and see, you know, how many more people can benefit from all this. And so, once again, just like when I developed and had a few patients come in for concussions, and I was like, how can I best go about healing and figuring out the concussions? I had to develop that protocol.
What was the last one you placed?
This one, esophagus, vertical. Here's pyloric sphincter, or pylorus, and here's her belly button. So she actually has 3 on the pylorus, so I'm just gonna place these other 2. So one is pylorus with liver. The other is pylorus with left tongue. And so I like to use some of the same tape from the others that I already pulled off, just so that it makes things go faster. I don't have to continue spending time on tearing out new pieces of tape. Then she's got descending colon, descending colon.
One of the pillars was red.
Was it?
Wasn't it? Didn't
Oh.
have pylorus?
Oh, thank you for that. What was it to?
Stomach?
Stomach? Okay.
I think.
It's all the way at the end of the list, so I was going to get to it, but thank you very much for that, Mark. So there's stomach with pylorus, pylorus with liver, and the other pylorus with left tongue. There. Perfect. Done, done, done. Now we've got descending colon to descending colon. So descending colon vertical, descending colon. And so it's just below an imaginary line. And I'm going to put it there, have the belt hold it in place as well.
So is there a maintenance, general daily maintenance you do with yourself or anybody you recommend? Like vital energy, thymus, Sylvian fissure, carotid artery, cervical plexus?
No. I honestly recommend a lot of the drainage points to patients.
Flush it out, huh?
Just to continue flushing your body of toxins. Here's clitoris, and so obviously you don't want to, put your hands in there. I always gently will grab it from the tape, relax, and so that you're not pushing it. Just let it fall, and then secure it onto the belt or the button, and that way the only thing they feel is the pressure going here. You don't have to apply pressure to anywhere else. So I recommend a lot that patients clean their liver and do the liver detox pairs. Liver from the front, liver from the back, do kidney, do subclavia, do mastoid, do TB on themselves monthly, inguinal, also parotid, that is, because the MMR vaccine, it's super ridiculously common. Sigmoid with rectum in the back, lift your hips. Yep. What's that?
You were talking about kidney stones before?
Yes.
Points to get rid of kidney stones?
The points are kidney, scapula, the TB, and you have to search for at least 2 other pathogens. Plus, there's got to be an underlying emotion. Yes. And so just in the pairs that we found today, we saw that some of them had emotional components. Not to tell stomach, not stomach pylorus. I actually was inverted because of you guys.
Hmm?
I would have discovered that upon.
Just making sure you're on your toes.
Uh-huh.
No, use that as a demo.
I would have discovered that it was uneven. That's why you write everything down. Liver with pancreatic tail. So just throw another liver.
Somebody has
Yes.
a lot of coronary artery obstruction, and there's a family member who is supposedly getting surgery. Is it dangerous to do magnets because I can move the plaques in your arteries and force it?
No, my father had aortic stenosis, and he was 3 weeks away from getting the surgery, and he finally, after 10 years, allowed for me to place magnets on him. And I told him, I said, you know, I don't expect for this to avoid the surgery at all, but I do expect for it to improve your circulation, improve your body's ability to heal, reduce the overall inflammation in your body, and just, you know, optimize the way your body's going to respond to the surgery. And so he was supposed to be in the hospital for about 6 days in recovery. He was in the hospital 3 days, and they let him out because everything went into balance immediately. His blood pressure, his bowels, his breathing, everyone was astonished that he was up and about literally that evening of the surgery. They're like, wait a second, you should be in pain, you should be this, you should be weak, you should be... No, everything was within normal range. So that was left kidney over here with splenic flexion over here. And go back and now check and confirm that her legs were nice and even, which they are. Another thing that I like to do, depending on how much time, is go back through and just confirm that those pairs that I've placed, that they're good. Oftentimes, one more personal pair may come up, or something else may open up. These have already been working. So I'm going to go through center corpus callosum. So one of the other TB pairs could have come up, but because I put TB on, I don't think anything's going to come up. Atlas, interciliary, cranial, thyroid, third cervical, spinatus, esophagus, gallbladder, pylorus, nothing else in the pylorus. Awesome. Descending colon, clitoris, sigmoid, gallbladder, quadriceps, patella, pylorus, liver, left kidney. Yeah, all good. So, how much time do we need to wait? 15, 14, 13. Hey Siri, set timer for 13 minutes.
Your timer is set for 13 minutes.
Now, what happens when you check that they're uneven?
If the
After you
legs
placed
were,
everything.
okay, excellent. Here's the question that you asked before. Thank you for that. So, if I were to check and the legs happen to be uneven, then I would ask, am I missing a pair for one of these placements? Oftentimes the answer is yes. And so I'm either missing it because the magnet has slid, to the left or to the right, and I can just add it in the proper position and it'll take over. So, did it happen to Mona? Yeah.
So you were missing one magnet.
I was missing one magnet in my doing everything quickly. I forgot to place a magnet. So it would have happened with pylorus stomach. I would have come back here and her legs would have been uneven, and I would have been like, am I missing something? Yes. Where am I missing something? Head, neck, thorax, etc., etc. I would have gotten down to abdomen and then found stomach and then be like, wait a second, there's already a stomach point. But you want to think through things slowly and carefully and not be like, oh my God, what do I do now? Jesus, I'm lost. No, just keep calm and ask the body. And so in her case, I forget, I think she was missing one more pair on the bladder, you know, somewhere for drainage. And so you just ask. Either you're missing it because you forgot to put it, or you misplaced it. Instead of putting it on the liver, you place it on the spleen, so it's the opposite side, and it's okay. It's not going to do damage or harm. You just need to put it on the liver. And so, you know, Howard misplaced the magnets before, and he switched black and red, and so, you know, he was convinced that he placed them correct, which they were anatomically correct, but the color wasn't correct. And so, you know, you can catch some of those things.
I'm used to trying to put them on in this environment. You know, I'm usually alone in my office with a person, and, but thank you for catching it.
Absolutely. And once again, had I not caught that, she wouldn't have felt worse because of it. It just wouldn't have worked. She just wouldn't have gotten the benefit that she did. Yeah. Any other questions? We've got 11 minutes to go. How have you guys felt, out of curiosity, just from today's activities and practice and going over the protocols?
Headed to another life.
Excellent. Slide. So if, let's say, on the body, that's the belly button. Let's say, here's the groin area, and here's the abdomen, and here's the breast, or pectoralis there. And there are the abdominal muscles. The appendix, here's the anterior iliac crest. The appendix is 1/3 of the way here. Appendix would be there. The ileocecal valve is here. The ascending colon is this portion. And then the liver, say the rib cage comes down here. The liver is protected by the rib cage and goes up here to there. And so this is ascending colon going up here. At this area, it kind of does that and then goes back there. And so this is the hepatic flexure. This is transverse colon just underneath the belly button. And then over here on the other side, it also goes up and then comes down. And so as it goes up, that's the splenic flexure. So this is splenic flexure. And then this is descending colon, and then here is the sigmoid colon, and then here the back rectum, and then obviously down underneath under is anus. So I know I'm not Picasso, but hopefully.
It's exactly what it sounds like. Splenic flexure.
Yeah, exactly. Towards the spleen and hepatic flexure towards the liver. So it bends and goes up towards that. So you have left kidney black, splenic flexure red. So let's see what that represents. Does it represent pathogen? Yes, it does. Bacteria, virus, fungus, parasite. Is it a known parasite? No, unknown parasite. Yeah, you're full of parasites. All right. It is what it is. Okay. Scapula. Oh no, I already went there. Kidney. Anything else on the right kidney? Left kidney. Renal callus, floating rib, quadratus lumborum, axilla or armpit, deltoid insertion, deltoid tuberosity, bursa, humerus, elbow, brachial, ulna, radius, wrist, palm, index finger. All fingers are good to go, so you could ask about thumb, index, middle, ring, and pinky, just to let you guys know. So thumb, index, middle, ring, pinky. All good there. Sacrum, coccyx, rectum, anus. Greater sciatic notch, Douglas sac, ischioramus, lumbar plexus, caudacina or horsetail, iliac crest, femoral neck, greater trochanter, tensor fasciolata, lesser trochanter, tensor fasciolata, it's twice, okay. Adductor, femoral fossa, popliteal fossa, external knee ligament, internal knee ligament, tibia, calcaneus. Calcaneus, calcaneus. That's rickettsia. So I already have the calcaneus pairs on her. So now it's just a matter of, all right, mentally I'm activating. But at least the body's letting me know, hey, she's got that pair. So the 3 pairs for rickettsia are wrist, wrist. I think I go over that tomorrow. Wrist, wrist, temporal lobe, and calcaneus, calcaneus. So at the end, now that I'm activating this, I want to ask about temporal lobe, and wrist, wrist. Oftentimes, I'll just throw them on. Achilles. Or is there anything else in calcaneus? No. Achilles, popliteal, sciatic, ischium, gluteus. Complex pairs. Pain, tooth, bladder, subdiaphragmatic, cardiac sphincter, gallbladder, nutrient artery, appendix, pelvic floor, renal capsule, vagina, urethra, interior iliac, stomach, femoral, neck, dog white, scar, parietal. These are all the reservoirs. Postpineal, pineal, corpus callosum, pineal, appendix, kidney, quadriceps, rectum, ileum, pain, belly button, cervical, adrenal, duodenum, bladder, prostate. And so when I went by quadriceps, it no longer registers anything because the magnets are done, they've been done, and there's nothing else balancing out with them. Belly button. Now we're going through the emotional pairs. Belly button, postpineal, central sulcus, sylvian fissure, adrenal, thymus, pineal, liver, stomach, heart, spleen, patella, fear. Have you been feeling fearful of anything lately?
Only the whole transition of my life since 2017.
Okay. There you go. You had a major and you moved. Yeah. So, once again, recognizing that and working on it, and probably, hopefully, realizing that now you're in a better place than you were maybe 6 months or a year ago, or when you first did that, right?
Definitely.
There you go. Keep that in mind and, remind yourself, things are improving. But we tend to hold on to certain fears of that. Yeah. Once again, my wife and I went through plenty of that coming over, and those of you that have moved from one state to another, country to another, it's tough in the beginning. Absolutely. Medulla, thymus, back of the hand, lung, trachea, lung, transverse colon, cerebral amygdala, atlas, occipital, postpineal, hippocampus. Now we're getting into the tumoral phenomena. So, does she have an infiltrate, Sjogren's, exudate, cyst or polyp, abscess, dysplasia, benign neoplasia, slow growing, benign neoplasia, fast growing, cancer, metastasis. Obviously, if none of those, then no need to continue into septic necrosis. But obviously, I'm saying everything out loud now, but with the patient, when you scan that, because today it might read, benign, fast-growing neoplasia, but guess what? You've already found 2 bacteria plus a virus, and you may be missing the fungus that's there. But next session, you ask about that, and it's no longer reading benign neoplasia. It's reading maybe exudate, which is just one pathogen, or a cyst or a polyp. And so it changes from session to session as you continue to get rid of those things.
So if you got a positive on any of those,
You
like
mark it
virus,
down.
virus, are you though gonna say what virus be associated with?
Yes.
Right? You're gonna go
Absolutely.
through all that.
Go search them out. Once again, you can go as deep down that rabbit hole as you want. Depends on how much time you're willing to, sit there with the individual. And obviously, we all have to keep our timing and rhythms during the day. And so I dedicate an hour and a half per person, and I'm able to scan through it all and ask a lot of those questions. But in the beginning, it was 3 hours, and then 2.5, and then 2, and yes.
So do you scan like per page to see if there's like something on this page or this section or
No.
whatever, or you actually scan each and every individual
I
thing?
scan each and every individual, exactly as you saw me do. That's the way I scan. Only when I'm scanning for a personal pair, then do I, honey, I'm gonna put these on and then continue taking questions, and then we'll be finished in about half an hour or so. Where was I, train of thought? Yeah, only when I'm scanning for a personal pair that, okay, where is the other magnet? Somewhere on my abdomen sheet, there's 3 sheets that I have of abdominal points. So I'm not gonna go through the 100 pairs. That's why I did sheet 1, 2, or 3. Only because I'm looking for that quick answer of where's the other pair. But I'm not going to go through her entire scan of what does she have on page 1, something between 1 and 20, 20 and 30. Like, no. I feel it's much more effective when I focus on the body part and the region. I'm able to detect and be more sensitive with that. And so some students from other courses, they're like, I'm not getting good results. And I'm like, well, how have you been scanning? Oh, ask what's on page 1 and, 1 through 20 and 20 through 30. And no, like, really get more involved. So I found that has worked wonders for me. So here she's got cervical vertebrae 1 with cervical vertebrae 1, but she also has cervical vertebrae 3 with supraspinatus. And so I'm just going to put this other one underneath, and so because cervical vertebrae 1 is here and 3 is here, this is big enough that I'm going to activate it so that it, is going to get cervical vertebrae 3. Okay. I can take other questions.
These other sheets that you speak of, with the 1, 2, or 3, are those, that's not stuff we have, though, is it?
No.
Okay, so,
Once again, I scan close to 1,000 points on people. Left your head.
yeah.
And so I would love to, give everyone that, but it involves me creating a whole nother book and giving, creating a whole nother course, which I do want to do. Just each pair has its own set of pathogens and issues and this and that. And so putting this, it's a lot. And you guys haven't even finished absorbing all this.
That's like 600 more points.
It's, I would say because I have detected and discovered a lot of new pairs and still figuring things out, I would say maybe another 350 would be all that, people really need. I just am kind of OCD about things and like to really investigate. And that's, once again, why I decided to go off to Africa and work with malaria patients and figure out those points. And, I wrote down very methodically and tested out. Honey? 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 Can I get the little pairs? You brought me all the big ones and then, yes, please. So I found out
that I'm not.
There are a bunch of little ones there. They're being sterilized.
Oh.
And there are 2 more here on the side.
Now I'm going to continue with everything, and I'm going to start my timer. Even though somebody showed me this the other day, which was really cool, even though I'm sure on your devices it'll probably happen. Siri, set a timer for 15 minutes. Oh. Hey Siri, set a timer for 15 minutes.
She's sleeping on
All there, tuberculosis, they're all there. So in Yersinia, you see number 9, bladder, vagina. In tuberculosis, you see number 7, bladder, vagina. Over here, HIV, number 5, you see bladder, vagina. It's a great drainage reservoir point. I think in a few of you, when I scanned, you also had bladder, left testicle, bladder, vagina. It's just a great drainage reservoir that you guys should consider at the end of the therapy and ask, you know, should I use bladder, left testicle, bladder, vagina to drain any of these pairs? Oftentimes the response is going to be yes. You don't have to ask which pair am I draining, just ask yes or no. If it's a yes, put it on. I have had patients that I needed to do 3 bladder, left testicle, or 3 bladder, vagina pairs. And so in the same session, it just keeps repeating. Oh, wow, more draining, more draining, more draining. So, so the vaccines, English measles, that's in the book, but it's stomach to adrenals. German measles, it's in the book, but it's atrioventricular node to left kidney. And check. Okay, there's a tiny, maybe 1/8 of an inch difference with the big toe. So there definitely is trichophytum there. It's not a lot. That's why he hasn't experienced anything. Let me grab another one and see, check his 5th toe. See if there's anything there. Yes, there also is in the 5th toe. And so this should start to change the smell. Not immediately, but over time. Also, those of us that have been staying at the hotel, hotels are the #1 cause for fungus in the feet or athlete's foot. So after you guys get home, back to your own homes, I would say, just as a precautionary measure, place these pairs. 1st toe, 1st toe, 5th toe, 5th toe. And it's obviously black to red. So there. Once again, it was your right knee or left knee? Left. What area of the left knee?
It was medial.
Medial tendons, okay. So I like to place a piece of tape. Okay, so here's his patella. The medial area is here. So I'm going to place a piece of tape here, and I know his legs were even. I'm going to focus my intentional energies to this general area. And yes, his legs are off about 1 inch. Can you feel that? Okay. And so now I'm going to ask, should the magnet go black? And I give a gentle tug. No. Should it go red? And his legs absolutely go back to even. Leg length is restored. So that tells me in the area of trauma or inflammation, the magnet goes red. And so here I can now observe, and I'm no longer thinking anything, it's the magnet that's throwing off his leg length. And so now I ask, where does the black magnet go? Somewhere in his head, nope, neck, thorax, abdomen,
pelvis, boom, pelvis, pelvis, and the uterus, ovary, fallopian tube, bladder, right in the bladder. Hold on, so it's actually right here.
Why is this pointing at my belly button?
Oh, okay, sorry. So bladder is below the belly button where when you push, it sinks in, and depending on how you wear your pants, trousers, it can be roughly just below the belly, the belt. And so now I check, hold on, because these kind of want to come off. Now it's not going to go anywhere. Okay. So now we've got bladder 2, area of trauma, and they're in balance. So now that they're in balance, I'm just going to double check and see if it requires another pair. And they're even. So this, I feel, bladder to left internal knee ligaments is going to finish off the draining of that trauma that he had how long ago?
It was over a year ago.
Over a year ago, but he still feels like it still hasn't resolved. This should help it resolve. Were there any other areas, or it was pretty much this area?
After it seemed like it got better, it did, it went to, I developed like almost a sciatic condition on this side.
Okay.
But it has resolved, I guess.
Okay, so he's saying that he developed like a sciatic condition on that side. You can check sciatica, sciatic notch, and lumbar plexus and all those. I'm going to go with a bigger magnet just in case and see if there's something else in that entire general region. Place a bigger magnet and no change. So now we just wait 15 minutes.
That's red you use?
I used red, yes. But only because I asked his body. I used muscle testing to check.
More often than not, you said the injury site is red.
More often than not, the injury site is red, yes.
Like this, you would ask the body how much it can handle, for example, how many pairs, or whether it has a priority to work on.
Yes.
And then they'll
The-
deeper in.
Absolutely. The body pretty much, yeah. It's not going to show you all of this all at once, believe me. But session by session, these are going to come out. And so I could do a whole nother different chart for colitis. I could do a whole nother different one for diabetes, etc. When am I going to have time for that? I don't know. But this is Lyme's as well as can be considered cancer. And cancer in the general sense of the word, because once again, every single organ that has that diagnosis is going to have a particular subset of microorganisms that are contributing to that. But after years of analysis and comparing patient notes and asking and this and that, this is the line. And when they are so heavily medicated and when they are feeling like life is lost and they have nowhere more to go, you gotta work on those emotions and you gotta, be patient with them because they are toxic from all of the meds that they've been on for years. It's rare for us at the Morrison Center to find someone that was recently diagnosed with Lyme. They usually come to us after having had the Lyme diagnosis for 5, 10 plus years. They've tried all around the world and we are their last stop, their last hope. And they're here at the Morrison Center with us because they've heard through word of mouth that patients are getting better. And once again, sometimes they also have heavy metal toxicity. And so we have to give them IVs for those heavy metals. And we combine with ozone, we combine my protocol, we combine with vitamin C and antioxidants and other things, proteins and amino acids and ketone, seawater, electrolytes. So have this in the back of your mind, and once again, with my common most pathogens, all of these are there. They're all there. So just if you focus on that sheet and clear absolutely everything from session to session, you should be able to have phenomenal results with Lyme. Phenomenal. Don't expect for everything to appear all at once, because it won't, I guarantee. And I will scan them twice in my sessions, and I'll only get, maybe 5 or 6 of these. And then the next session, all of a sudden, it's 5 or 6 different ones. And I'm like, I know I scanned them twice, and it didn't come out. The body wasn't ready for it to come out. It's like an onion. It comes out in layers. It has its priorities.